Hello, everybody. My name is AJ. I'm an athletic training student at Cal Baptist University. This video is going to be talking about the management of acute cervical spine injuries in athletes, and I put together a slideshow, so here we go. Hello, everybody. Here's the slideshow I put together about the position statement regarding management of a cervical spine injury. The objective of this statement was to provide athletic trainers, team physicians, emergency responders, and other healthcare professionals with recommendations on how to best manage a catastrophic cervical spine injury in the athlete. The purpose is pretty similar. It's stated that this provides the athletic trainer, team physicians, and other healthcare professionals with recommendations and clinical considerations for managing a major, potentially catastrophic cervical spine injury. What is a catastrophic cervical spine injury? It is a structural distortion of the cervical spine column associated with the actual or potential damage to the spinal cord. The recommendations are based on current research and expert consensus. The recommendations will help give information that will be concrete and helpful so that the healthcare professional can be prepared for any situation, even as devastating as a spinal injury. Some preventions provided. The athletic trainer should be familiar with the sport-specific injuries. The responsibility of knowing the emergency protocol and how to execute it. The athletic trainer should also know the sport-specific equipment protocol, and also the athletic trainer should be responsible to educate coaches and any assistants. So back to the sport-specific equipment protocol, it is a good idea for athletic trainers to be aware of what sport they are managing. So, say they're watching football, ice hockey, or lacrosse, anything with helmets, they need to be aware of that sometimes the helmets need to stay on the athlete. For example, in ice hockey, if the athlete is in the supine position and the athletic trainer takes off the helmet, well, the head of the athlete will fall because the pads are higher off the ground, and so it is a good idea to keep the helmet on to keep the head in a neutral position. Athletic trainers should also have a plan in place, and the NATA provides plans, also position statements on what to expect and how to plan for an emergency. The athletic trainer should have appropriate equipment and should be available for any situation. The athletic trainer should also be aware of the venue-specific incident. So, for example, if the football game is down on a football field and there's limited access for the ambulance to get to the field, the athletic trainer needs to put together a plan that will be able to be suffice enough for the athletic trainer to transport the athlete to the ambulance. And also, the athletic trainer should perform at least one rehearsal per year, and any new healthcare individuals, so like any assistants or anything, they should be briefed on the emergency plan. The assessment and stabilization. The athletic trainer needs to be alert for any catastrophic cervical spine injuries. They need to look out for if the athlete's conscious or unconscious. They should also look for any deformities and keep the head stable even if there's no obvious deformities. And also on that note, if the head is not in the neutral position and the athletic trainer tries to put the head in neutral position, if the head won't move to neutral position, they should just keep the head as neutral as possible. So do not try to force the head into neutral position if it won't go easily. Also, the athletic trainer needs to immediately apply manual cervical spine stabilization and keep the spine in neutral position and modify if necessary, like I said earlier. The airway is something else to look out for because sometimes some athletes will have mouth guards, so the airway will be compromised. So the athletic trainer needs to expose the airway immediately and remove any objects that can interfere with the athlete's airway. If the airway is compromised, the rescuer should keep the head as still as possible while removing the object. And then when we learn in CPR, we learn to do a head tilt, but in this case, head tilt will not be recommended because that makes the head move too much, basically. So instead of a head tilt, the athletic trainer should perform a jaw thrust, which will allow more air to get to the airway without moving the neck too much. And then to transfer an athlete that has been injured, the athletic trainer should have a spine board available and ready. The person at the head should be at the person at the head should be the athletic trainer, and they should keep the head in neutral position or modified. And there are two techniques that are commonly used, which are the lift and slide or the log roll technique to get the athlete out onto the spine board. Also, if the athlete is in prone position, the preferred technique is the log roll. This just provides the least amount of movement for the head. Here are three examples of how to spine board a person, an athlete. So the very top picture is a person in the prone position, and you can see the athletic trainer on the very left picture, the left top one. The athletic trainer is keeping her hands in a way to where when the other assistants move the athlete onto the spine board, the athletic trainer can easily keep the head in a neutral position and allow least amount of movement for the head. The second picture right in the middle is a example of a lift and slide. So you can see there's 5 or 6 people lifting the person up and one person sliding the spine board underneath. This is a very quick and easy lift, but if there's not that many people available, then the log roll method is also a great method. In this picture, it shows 3 people. You can use 3 people or more, but or less. You can use 2, but 3 is preferred. And the way this happens is that the athletic trainer will be at the head and keep the head in neutral position while the assistants roll the athlete onto a 45-degree angle as someone else places the board at an angle underneath the athlete while the assistants slowly roll the athlete onto the spine board. Here are my references. The reference for the article and also the title is called The Acute Management of the Cervical Spine Injured Athlete. Also, I just want to state that I would definitely recommend everyone reading this. Just everyone read this article just because it gives very good information. It's literally like 12 or 15 pages long. It is a little long, but it's definitely something to keep in your library because it provides a lot of really good in-depth information that I could not possibly get into within this 5 to 7 minutes. So definitely, if you have the time, read this or just keep it in your library and keep it for future reference. Hope you guys have a great day. Bye-bye.